The guidelines on improving the capacity of Shanghai's public health system note the city's success in the COVID-19 containment effort, while also identifying areas that need attention. Plans include creating a unified health monitoring system and a multi-level emergency treatment system, beginning with specialized city-level hospitals, regional treatment centers, and community health centers. The city will also set up plans for emergency training, drills, and supply networks. The Shanghai Health Commission says the plan calls for major changes to the city's health services.
Hospitals will increase the number of wards and the size of fever clinics to ensure extra capacity is available. We need not only doctors from infectious disease departments, but also all medical workers to be familiar with infectious diseases and epidemiology, including doctors in the respiratory, emergency, and ICU departments. Training is crucial. We need comprehensive talents.
Though China's expenditure on public health systems has increased from 3.5 billion yuan to 1.6 trillion yuan over the past 40 years, the proportion of expenditure on public health here still lags world levels. In 2018, central government expenditure on the health system accounted for 1.7% of total GDP. The World Health Organization, however, says that globally, fixed assets in health systems accounted for an average of 10% of GDP in 2017. Experts say additional investment should not only be made in the public health sector, but also in related industries such as banks, high-tech support companies, and schools.
In the university, we are strengthening our public health education, and even in the high school or primary school, but we also transfer those our public health and things into our students. And all the procedure of prevent those diseases. We need a test, we need diagnosis, we need treatment, but that's all, I think, related technology. Maybe later we just 5 minutes know what kind of COVID-19 and positive people.
A report released by the Innovation Center for Social Risk Governance in Health led by Fudan University said in 2015 that there was a 31% gap between government investment in healthcare and the overall amount of investment needed. Experts say, however, that the private sector, and not just the government, should also be involved in creating the public health system. That means banks, high-tech companies, and medical supply firms.
Sometimes in the public health sector, and maybe no too much and just financial benefit. So, and the government should do that. But I think that the government just leading the actor, but not just the government only actor and involving. So, for example, a lot of like APP and actually, and that's we can leave the market to do it. And so to test temperature, to look at your surrounding, how many people maybe and suffer diseases. And so I think give a lot of opportunity for the industry and invest in the health and especially in the public health sectors.
China established an infectious disease reporting system in 2004, and the first batch of investment to expand this is already on the way. The Asian Infrastructure Investment Bank this month approved a sovereign-backed loan of $355 million to help upgrade China's sustainable public health infrastructure and provide emergency equipment and supplies. That will go to strengthening the public health emergency response capacity in Beijing and Chongqing. Zhang Shixuan, ICS for CGTN, Shanghai.